So I'm Holly Humphrey. I'm the homelessness prevention team leader, and I look after the families side of the team. For a bit of context, the homelessness prevention team is split into two. So we have a team that specialises with single applicants and childless couples, and then we have a families team. The reason we did that is just because it helps with our joint working. I'm going to give you a quick run through today of how we define homelessness, what the process is when it comes to if you're working with families or single people that you identify at risk of homelessness, how you can refer them to us, and sort of what happens after that. So I'll run through, and then at the end you can ask questions, and if there's any points that you want me to expand upon. So we consider someone is homeless if they haven't got accommodation, which is they have a legal right to occupy. So that will be if they're going to be, they've been served a notice to quit, they no longer live there, for example, or it's not reasonable for them to continue to occupy. So when we look at reasonableness to continue to occupy, we look at many things. We'll look at reasonableness when it comes to suitability. So it might be that there are significant medical conditions that make the accommodation unreasonable. We look at risk. So when it comes to domestic abuse, we will assess whether the accommodation is reasonable to continue to occupy as a result of that risk of domestic abuse. And we'll also look at if there might be category 1 hazards, for example, in the home, which would then warrant that they don't have that. It's not reasonable for them to continue to occupy. We define someone as being threatened with homelessness where they are likely to become homeless within 56 days. So on that, where they might have been served a notice to quit from private rented accommodation, or they might be living with family members and they've been asked to leave because of overcrowding or because the situation is untenable. So those are the sort of the two definitions. If we assess someone as being threatened with homelessness, we issue what's called the prevention duty, and I'll come to that a little bit later down the line. But that basically is our statutory response to say we are assessed that this person is at risk of homelessness and we have a duty to provide them ongoing support to secure alternative accommodation or support to remain in their current accommodation. The relief duty, which you might have heard of before, is when we assess that someone is homeless. Areas where there might be risks of homelessness, where it might not have been served a notice to quit yet, but where we would identify that there could be a future risk of homelessness, and where we identify the early triggers of homelessness. So an example of that is we always say that if people are having highlighted where they're not paying their council tax, that's a priority debt. So anywhere where we see priority debts increasing or other debts, is then an indication to us that the household is struggling to maintain their financial responsibilities. So that could then mean that rent is going to be the next thing that isn't paid. So if you're ever working with families where they're saying they're struggling to pay their council tax or they've got other debts, for us, that is a really early indicator of homelessness and is where we want to intervene earlier, so that we can start with earlier intervention and contact with that landlord to prevent a notice being served. As you'll all be aware, the cost of living is causing an impact across the board. So if we're seeing where people are struggling to manage their essential outgoings because of the cost of living, we can then refer into other relevant services to support with that. But again, that is an early indication that there could be homelessness in that future. Landlord issues as well is where you might be seeing that there's regular complaints being made to landlords, or landlords have highlighted that there's concerns. Perhaps there's been neighbourhood issues. All of those things, again, give us an indication that there is a risk of homelessness, and is where, from a homelessness prevention perspective, we want to know about it. The mechanism to refer into housing is the duty to refer. The the legislation that sort of governs the duty to refer comes from the Homelessness Reduction Act, which came in 2017. And as part of that, the duty to refer came in. And that places a duty on public authorities to notify the local authority if they are working with someone who is at risk of homelessness. The client must give consent to the referral, and the client is able to identify which local authority they wish to be referred to. Here on the next slide is a list of the statutory agencies that we would expect duty to refer to be received from. We actually receive duty to refer from a wider range of authority of supporting agencies that are also in the voluntary sector, not just our statutory duty partners. So we receive a lot of referrals from a variety of agencies, which is really, really positive. But we're always looking for more referrals. This is here when you might see identifying areas where we might want a referral. So all of those things here where we identify that there is a risk of homelessness, we need to know about it. If you're working with anyone where there's either those risks of homelessness which are identified, they've been served a notice to quit, or areas where there's early indications of homelessness, because for us, if we can intervene earlier, we can get much more positive outcomes than we do when we're left too late. The service is under extremely high demands from a homelessness perspective. We've got a lot of landlords that are selling. So if a tenant says, oh, my landlord's mentioned about selling, they haven't served me a notice, I want to be referred to at that point, not when the notice has been served, because if we can intervene earlier, it gives us more time to help secure alternative accommodation, or we can start discussing with private landlords whether there are incentives or options that we could look at to stop them from having to put the property on the market. The duty to refer is done by a web form, so it's on the Reading Borough Council website. All of the information that we need in that form is on that link. A brief things to include is just some basic information that we need: the client's name, date of birth, recourse to public funds. We need to know if they have recourse to public funds, because homelessness, we can't assist if there's no recourse to public funds, but we still have a duty to provide some advice. So we still need to know that. And although we might not be able to provide assistance, we are able to provide advice going forward. So these are just the basic information that we have on here. Barriers to contact, it's always really good for us to know that, especially when there's cases of domestic abuse. Is it safe for us to leave a message? Is it better to send an email in advance? Links to the Reading area, we need to know that just in confirming local connection, and around immediate needs, just so that's how we then prioritise that contact. So when we receive a duty to refer, it comes in as a referral. It's then triaged by our customer access team. They will contact the customer and try and do that triage process to get some more information on the back of the referral. They then identify whether it needs an immediate response, so that there is an immediate risk of homelessness that needs to be assessed on the day. If there's domestic abuse, we aim to assess that on the day as well, because we want to risk assess that situation to determine whether we need to have an immediate response or whether we can do a planned move on. If there's not an immediate response needed, it will go onto a appointment waiting list. So we have a list of families and single people that have identified of being at risk of homelessness, and each week they get allocated appointments. So I allocate all of those appointments on a weekly basis. So if you're working with households and they've said, oh, that I've contacted the local authority and they haven't had a response yet, do contact us again to chase it up, because it's always good to know when there's agencies working with families so that we can help prioritise those appointments. So the initial assessment will look at the reason for approach, 5-year address history, priority need status. That's more important when we're working with single households because we have different duties to those who are considered non-priority. Usually that just means that we don't have an interim accommodation duty, so no duty for us to provide emergency accommodation where there is not, where there's they don't have a priority need. Anyone with dependent children will be priority need, or if anyone is pregnant. We have to assess priority need for single households when we're looking at what their medical needs might be, their mental health needs as well. We look at finances. The reason we do that is because we need to understand what someone's income is to understand what's going to be affordable for them going forward when we're looking at alternative accommodation. We also do that to understand if there's income maximisation that we can do and whether we need to refer on to debt advice, for example. We also give some advice around, getting into employment and how that might improve financial options and then opportunities into the private rented sector. We'll also look at additional support needs and whether we need to engage with our partners to support those. We'll always look at risk, and that will include risk from others and risks to self. The risk from others is often for us to determine where is safe in Reading, whether we need to start looking at out of area options. This is a list of all the things that we request for in advance of appointments. Again, this is all for us to determine eligibility, income, and expenditure for us to determine what's going to be affordable going forward. We'll also need landlord contact details so that we can speak to the landlord and understand why someone might be served notice. If someone is being asked to leave from family, we will do that as a home visit. So we will go out to that person's home to determine, to understand the situation with all of the family members. We'll also look at that point whether there's things that we can do to help the situation be more sustainable. We could look at buying bunk beds, for example, and just get an understanding of what is happening in that family home to help us negotiate additional time and to make sure that all family members are aware of the options that we are able to provide. These are all sort of the options that we have available to us in terms of homelessness prevention. So we've got rent guarantee scheme, which I'll go into in a little bit more detail on the next slide. Private rented accommodation. We at the moment, because of the demand upon our services and the increase in the number of households we have in emergency accommodation, will be are offering incentives to private landlords. So cash incentives to try and encourage private landlords to work with the households that we are supporting. We have Home Choice, which most of you should have heard of, which is where you bid for social housing. Home Finder UK is a mechanism to access social housing outside of the Reading Borough. When we say outside of the Reading Borough, it is far outside of the Reading area. It is not close by. We're talking about the north of England, but there is an excess of social housing. Supported accommodation, that's more predominantly for single people who we're working with. So you might have heard of the Salvation Army and Launchpad who provide those services. We also have floating support services. So if people are working, in private rented accommodation, we can support them by providing tenancy sustainment. So Launchpad provide that at the moment, and we're also now recruiting to an in-house tenancy sustainment team, so we can do really reactive tenancy sustainment support. I mentioned before, we can refer into debt advice. Housing has its own debt advice service, so we can refer into that internally. And we can also refer into environmental health if we have concerns about the state of the property, which needs an expert viewpoint on it. The rent guarantee scheme I mentioned here. So we pay the landlord the rent and then the tenant is expected to pay us, but that rent is guaranteed for the lifetime of the tenancy. We can pay a 6-week deposit as well on top of that. So the eligibility is that you are on universal credit or on a low income, and you might not have any other funds to be able to secure that accommodation by yourself. The rent guarantee scheme, we're always trying to find new ways to encourage landlords onto the scheme, which is why we've been launching the incentives to encourage that as well. We also can make referrals into discretionary housing payments, so the DHP. Some of you might have heard of that before, and that might be where there's a shortfall with what the rent amount is and where what the benefit income is. So we can refer into discretionary housing payments for that. We also have our own fund of money called the Prevention Fund, where we can look at anything. We can be really creative with that fund, where we can look at ways to prevent homelessness. That might be clearing rent arrears. It might be, we've had a case where we purchased a heated airer because one of the complaints from the landlord was the condensation and then the damp caused as a result of drying washing on the inside of the home. So we said that as part of that negotiation, we paid for a mold clean, but we also paid for the dryer. So we can be really creative with that fund. But it's also used as a no interest loan for the households that we're working with to secure private rented accommodation for a deposit and rent in advance. Home Choice. So Home Choice is our social housing register. A lot of you would have heard about that. And this sort of covers all of the schemes, all of the eligibility criteria for joining that scheme. You will see, you might be working with families that will be asking about their priority band. So banding is awarded according to the allocations policy, which I can send around after this as part of the slide. Essentially, priority banding is awarded if there is a risk of homelessness, if there's overcrowding, and if there's medical needs, which mean that the home is unsuitable and needs, so that medical condition is being made worse by the current housing situation. Domestic abuse as well will be factored into an additional banding. That could be a welfare banding, or if the family or single person is in social housing, they can be put forward for a management transfer, which is like a managed move as a result of the risk in that home. I can answer at the end any questions around Home Choice, but I'm not the expert. So if I can always sort of answer the best I can on some of those. And the next two slides these are an example of the personalised housing plan. So anytime we assess someone who's referred into our service and they are identified at risk of homelessness or already homeless, our duty is to issue a duty and then to issue what's called the personalised housing plan. And that is a step-by-step plan which identifies the actions that are for us as the local authority to support that family into alternative accommodation, and also the steps that are requested of the customer. So it's a partnership. So when you're working with families and they've already come to see us, it's really good to ask to see their personalised housing plan, because you can see all of the steps that have been given to them as well. So you can say, oh, have you done that as well? Because it is done in partnership, and we do have to work with our customers to try and identify them, to help themselves, as well as us supporting with that. So that's just an example of what those personalised housing plans look like. That's the end of my presentation, so I'll stop sharing my screen.